Why are children falling ill so frequently these days? The biggest reason for that is that during COVID, for 2 years, children were in an overprotected environment, no exposure at all to viruses, bacteria, germs, nothing. They were at home in a very nice bubble. So now, when they're going to school, they are catching all sorts of viruses, and this used to happen every time a new batch of toddlers would start school. They will fall ill more frequently, but now it is three batches, and even the older kids, because they were at home for 2 years, their immunity levels also went down against viruses. So earlier, if one child would get infection, the other two could have been immune, so the viruses did not spread so fast. Now what is happening, none of these five children have any immunity. So if one gets a virus, it quickly spreads to all of them. That's why the viruses are spreading like wildfire. But hopefully from this coming year, the new academic session of children, things should be better. Their immunity levels should have increased. Another reason for this is the poor outdoor exposure, especially during COVID. If we are checking the vitamin D levels of children for whatever reasons, almost all of them have low levels, and majority of them have extremely low levels of vitamin D. And even post COVID, when I take the history, I find many children have almost zero exposure to natural sunlight. Many of the play schools, daycares are completely indoors, and I feel sunlight is not important just for the production of vitamin D, but in general also outdoor exposure builds a child's immunity. Number three is increased intake of processed food, fruit juices, packaged products. We are letting go of our traditional diet, and all these new age pre-packaged foods are affecting our children's immunity. Number four is a dismal rate of breastfeeding. Breast milk is the first vaccine, antibiotic, or whatever you want to call it for your baby, and the breastfeeding rates are very, very low, unfortunately. Not even 50% of the babies are exclusively breastfed. Also, the increasing rate of cesarean section also alters a child's gut flora. Similarly, abuse of antibiotics. So your parents use antibiotics at the drop of a hat. All these things affect your child's stomach or intestine or gut flora, and a healthy gut flora is important, because when some germs enter your child's stomach or intestine, this healthy gut flora will help in fighting those infections.